Hi everyone, it's Elle. Now we're going to be talking about the ASDS, the Acute Stress Disorder Scale. And I have modified it slightly, and we'll get to that. So, the way that I'm using this tool is right after moms have been screened for traumatic birthing experience. And if they had any kind of interventions, then this questionnaire would be given to moms, and it's used as a baseline. And then between a month to 2 months after, I contact moms again and give them the same exact assessments. And I'm going to look for, the baseline to the follow-up to see if there are any changes that are looking like perhaps PTSD, depression, anxiety. So this ASDS is going to be looking more at the symptoms of PTSD. So if you look down, there are 19 questions. I have here the modified one that I created, and below is the original. And everything is exactly the same, as you can see. And you can also explore this on your own when you get a minute. The only difference is I changed the word trauma to birth. So down here it says, during or after the trauma, did you ever feel numb or distant from your emotions? And up here it says, during or after the birth, did you ever feel numb or distant from your emotions? And the reason why I did that is some moms did not score any points in that screening questionnaire, those 4 questions to see if they experienced a perceived traumatic birth. So some mothers do not see their birth as a trauma, and to write it that way kind of stacks the deck and makes it a little complicated for them. So just writing birth makes it more neutral, and also it communicates better what I'm asking, especially for the follow-up. Because with a follow-up, it's something that moms are going to be filling out without me there or somebody to explain it. So it's more important that they have the direct language that they can answer directly. So the way this works is you answer it and you circle 1, 2, 3, 4, 5. I actually give this to moms using a Google Doc, and I will include the link to that as well. So the moms say, okay, 1, not at all, 2, mildly, 3, medium, 4, quite a bit, 5, very much. So during or after the birth, did you ever feel numb or distant from your emotions? So let's say the answer is 3, so they'd circle 3, and they'd go through each of these questions, each of the 19 questions, and at the end they would add it up, and anything greater than 50 is something that's concerning and should be followed up with your physician or your counselor, somebody to kind of explore. So when you do go to your physician or your counselor, I would bring a copy of this with you, or at least the score you got, so you can go over that together. And this is, of course, a standardized test that's based off of, psychological information. It is a psychological assessment. That's the journal that it was published in. And so it's really just to make sure that moms are not experiencing any kind of symptoms that would indicate PTSD. But again, this more of a screening questionnaire. It's not something that's going to diagnose anybody. In order to be diagnosed, you do need to go to somebody who is able to diagnose. So, for example, a psychiatrist, and perhaps depending, your primary care provider might feel comfortable diagnosing, and maybe a clinical psychologist, etc. So just go in, bring this in so you can chat with them. For any healthcare providers, you may have heard of the ASDS. There are 2 different ASDSs. One has to do with autism, and clearly this is not that one. This is to do with acute stress. Okay, all right. Well, good luck administering the test and or taking it. Bye.